Hi everyone. In today's clip, I will talk a little bit about MRSA. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. MRSA is a type of Staphylococcus aureus bacteria resistant to many common antibiotics, including methicillin, penicillin, amoxicillin, and this is usually passed by skin-to-skin contact or by sharing personal items like razors, sport equipments, or towels with someone who has the infection, or even touching infected surfaces. MRSA symptoms are not always present. Many people carry the bacteria without any signs of infection in a state called colonization. When symptoms do happen, they typically begin as a skin infection with redness, swelling, warmth, and possibly pus, often resembling a boil or infected cut. There are two major types of MRSA. We have HA MRSA, or healthcare associated, and this is contracted in hospitals, nursing homes, or after any medical procedure. And we have CA MRSA, or community associated, which happens in otherwise healthy people and often being with a skin condition, skin infections. It typically causes sort of skin infections, boils, abscesses, cellulitis, and severe infections, if it spreads, will come about in pneumonia, bloodstream infections, bone, joint infections, and sepsis. The conventional treatments for this ailment, because MRSA resists many antibiotics, requires careful selection of antibiotics which are still effective depending on the strain and sensitivity, such as like vancomycin, daptomycin, clindamycin, and many more. Now, another way would be through incision and drainage, or IND, for skin abscesses, which they may sort of drain the pus rather than sort of relying on antibiotics. Of course, infection control and strict hygiene in hospitals and homes are recommended, like hand washing, gowns, gloves, surface disinfecting, isolating infected sort of patients, and so on. On the wholesome and integrative therapy side, we look into lifestyle choices and nutritional supplements. Apple cider vinegar, or ACV, capsules, liquid, or powder form, exhibit strong antimicrobial and anti-inflammatory properties in laboratory testings and settings, and demonstrating the ability to actually kill MRSA and inhibit its growth. ACV's effectiveness stems from its ability to penetrate bacterial cells and alter key proteins and potentially boost cellular defenses. Beyond sort of direct killing, ACV also demonstrates anti-inflammatory activity and strengthening of cellular defenses. ACV can also enhance the effectiveness of certain antibiotics, particularly, for example, cefoxitin, when used together, of course. But ensure to ask your doctor before you mix these two, and don't do it on your own. Vitamin C, immune booster, antioxidant. This is my go-to if something like this ever happens. When you wake up in the morning, you start by taking 3,000 milligrams of vitamin C every 30 minutes, religiously again, and continue until you have a single episode of loose stool, not quite diarrhea, but loose stool. And if you haven't had loose stool after 15 hours on this dosage, then you're going to have to increase it to 4,000 milligrams every 30 minutes. After you have a loose stool movement, you reduce the dosage to 2,000 less. So if you're taking 3,000, it'll be 2,000 milligrams of vitamin C taken every hour now. So now you will quickly find the dosage that is right for you when you're doing this. So adjust the dosage of vitamin C downwards to stay below the dosage that will cause loose stool, and adjust it upward to relieve MRSA symptoms. So continue the oral vitamin C therapy until all the symptoms have disappeared. And I usually go, if something like that happens, would go a couple of days even after that or a week after that to make sure that everything is all right. Then we have vitamin D3 and K2, low levels of which are linked to infection vulnerability. And of course, this supports immune modulation. Zinc, which is essential for wound healing and immune defense. Probiotics, which restore gut immune balance, especially after antibiotic use. Vitamin B3 or niacin, which has antibacterial effects against MRSA. Blue light therapy, which can stabilize MRSA cells, destabilize, my bad, destabilize MRSA cells, but I don't believe it's currently being sort of considered. Garlic, which has allicin, which has antimicrobial properties, is studied against staph bacteria actually. Curcumin or turmeric, which is anti-inflammatory and can inhibit bacterial growth. Manuka honey, UMF 15 plus or higher. Topical application of this shows actually antibacterial action against MRSA. By the way, UMF stands for unique Manuka factor. This system is a quality assurance or the trademark that tests for natural markers to guarantee purity, quality, authenticity, and making UMF 15 plus a therapeutic grade honey, basically, which is recommended for supporting well-being and boosting and a boost in antibacterial activity. Then we have oil of oregano, which is another beneficial supplement studied for its antimicrobial effects. Tea tree oil, as a topical antiseptic, can be used in washes and or in ointments. Good hygiene, regular hand washing, not sharing towels and razors, boosting natural immunity with whole foods, hydration, sleep, stress reduction, and of course vitamins. Detoxing through sweating, let's say going to sauna, lymphatic massages, dry brushing for skin and lymph drainage, using warm compresses on sores, keeping the wounds covered and clean. And on the emotional side and metaphysical side of things, this ailment usually is related to the fact that infections often symbolize anger, irritation, or conflict. Basically, it's boiling over. MRSA specifically can mirror if you feel that your feelings are attacked or invaded by others. Resistance to authority or external control, mirroring the bacteria's resistance to antibiotics. Suppressed anger or unexpressed resentment that sort of festers beneath the surface. Also, it represents a need to strengthen personal boundaries, your inner power, as well as your self-protection. Hope this has been helpful. Like and follow for more. Be the light.